Hello, I'm going to be showing you how to use the new chemo order set templates. So for now, I will show you where they are located. They are in the test templates under Katrina. This is the CAC that helped us build the templates. They will be moved under the chemo folder, but for now they are here. So you will go ahead and select the order that you will want to use. And at the very top, you have the intent of treatment selections that you can do here. You have the guidelines, a link to the guidelines, and a link to the references that the guideline utilize. You also have the myeloid growth factor, and any more hyperlinks that are related to the guidelines will be here as well. So we get into the chemo regimen here. You have the cycle length and how many days are in the cycle. So here you need to select how many cycles you're going to do and how many planned cycles. You can utilize the arrow boxes, or you can go ahead and type in directly in the box. Anticipated date of treatment, you hit at the ellipses here and select the date from the calendar. Next, you have the patient's information with their their weight and their BMI. You also have their height and their BSA. So this is pulled from CPRS. At the time you sign this note, this will be the most accurate data, but in the event that any of this data changes as time goes on, this will stay the same as it was when it was recorded. It will not update as the patient's information changes. So if you click the regimen, you will see that the actual treatment regimen from the guidelines will pop up down here. So you can go ahead and select all of these items. You can see there's 2 dexamethasones, and we'll get into that when we pull the orders up. But here you see what the dose is. This is per meter squared, and then the days that's going to be given. Dose modification, you have to select something here. If you leave it blank, it will do a warning saying that you have not put the dose modification options on. So I'm not planning on modifying the dose, but let's say we did here. We wanted to reduce by 50% for tolerance. You will put that information there, and it'll just record it in the note. It will not automatically reduce the dose for you. You'll see in the orders when we get to them. So the dexamethasones, we'll click both of these because one is for cycles 1 and 2, and one's for 3 and 4. And you'll see they say outpatient and clinic meds. We'll get into those in a little bit as well. So supportive meds and post-supportive meds here. Pre-meds and post-supportive meds. There are some medicines already listed out. These are items that the guidelines had highlighted as recommended to be given with this regimen. It is not the only options. And you can also see there are duplicates. So there are 2 Zofrans. There's a PO and an IV. You don't have to do both of these. If you only want to do PO, you could. And then you have these additional medicine boxes here. So these are things that aren't part of the regimen, but maybe something you want to add to this specific patient's treatment. So we have here all the things selected, and we'll get into those and show you. And then down here, we have also some risk associated with the drugs of this regimen as well. So we'll go ahead and finish, and it'll pop up our menu box here. This will start the ordering. So you can see this menu box, and it's somewhat of a table of contents of the things we're going to be ordering. So you should see an order set to go along with each of these items. So right now we're on the bortezomib, and maybe you've got to this point and you're like, I do not remember what the dosage was supposed to be. Well, right behind these boxes is our note. So we can see bortezomib is 1.5 milligrams per meter squared. And we also have that this person's BSA is approximately 2. So we would do 3. So we're going to do 3, but I'm actually going to let my finger slip, and I accidentally hit the 2 too. So I'm going to show you what benefit that does. So we'll go ahead and accept the order, and we're going to have a warning pop up saying that we have went above the maximum daily dose. So we can go ahead and change that, but it's just going to warn us that, hey, this isn't right. And a warning will pop up at the end as well. So we'll go ahead and accept it, and I'll change it at the end to show you what that'll look like. And then we have the cyclophosphamide. This is also another part of the clinic orders. A lot of this isn't already populated because it depends on the patient specific. So we have another meters per square, so that's going to be 600 on call. Leave this stuff as on call. That way it will always be available to be given at any time. Even though this patient is getting this every 7 days, if I were to put this on here weekly, it will look for it specifically at every 7 days. So if this patient's first dose was Monday, it would expect him to get it again the next Monday. If he came in on Tuesday, this order is not going to show up in BCMA and it's going to mess it up. So leave a lot of this the same as on call. And you may have saw that on bortezomib as well. It also had on call on it. And we'll get into a few more. So we'll accept it. And then we'll go ahead and go into the next dexamethasone here. So this is the dexamethasone where it's on days 1 through 4, 9 through 12, 17 through 20, and that's for cycles 1 through 2. So the patient's more than likely going to be taking a lot of this at home, so it is picking it up an outpatient medication. That is why you have a day supply at a quantity. We've already built this out to have a lot of the stuff defaulted in there, so you could go ahead and accept, double check it. If there's anything you want to change, you can do that here. And you saw it showed me that I had that duplicate therapy in there. That's this other dexamethasone. So we have this dexamethasone on right here. This is for cycles 3 through 4. It's only on day 1, 8, 15, and 22. That is the day they're coming in to get their treatment. So we did this as a clinic med so they can get this medication inside the clinic. All right, next thing we have is those clinic meds that are recommended with this treatment. So we've got a Zofran. This is going to be given inside the clinic. Anything we need to change, again, leave stuff as on call, but maybe we want to back down, go to 8, we can do that here. And then we have another Zofran here. Now this is the IV. You may need oral and IV, you may not. But if you are going to write a duplicate therapy, as we saw in those dexamethasones, you need a clarification of when you're going to use one over the other. So let's say this patient has difficulty swallowing sometimes. We got that oral Zofran, but maybe sometimes he can't swallow the Zofran, so we also got an injection. In the event patient is unable to swallow oral tablet, we can put that in there. That way we can have both the oral and the injection. Again, these are on call, which kind of act as a PRN medicine. Use one whenever is needed. So if you have that as a duplicate, 2 different medicines that are the same thing, just make sure you put something in the comments there to kind of clarify when you would use one over the other. Next, we have this generic additional meds. This is other medicines that are going to be given in the clinic. By the time you're watching this video, this might be titled something else. It might be actually called medicines administered in clinic or something like that. These drugs may also be in a different order. There may be new items added, but it is just a generic item. So we'll go ahead and click one here. So we can go ahead and select a dose. Since it's not part of the regimen, it doesn't have one already pre-selected for you. This is going to be something that is going to be on call. So if this isn't something that the patient's going to be getting every time they come in for treatment, it may be better to order this item in your clinic order menu instead of in this template. But if it's something they're going to get every time, feel free to use this and go ahead and order it this way. And we'll be done with that. And then similar with the infusion medications. It's just a generic menu of a bunch of different possible infusions you could possibly use. These will also be in your clinic order set as well that you could use if you don't want to use them through the template. You want to order them outside the template. So outpatient medications, again, these are the recommended ones. You got your dosage, your day supply quantity, all that already built in, comments, all that's ready to go. Just double check it. If you need to change it, you can. And then we'll pull up the next one, Zofran, very similar. I do want to highlight the difference between mail and window. For patients coming to you guys, it's not going to be much difference between mail and window. The day they're filled, they can be picked up at the window. If they're not picked up on the day that they're filled, they're mailed out, no matter which one of these you selected. Park is a little bit different. If a patient were to get something put on Park, it just stays on their profile and it's not filled until the patient requests it. So it may be something you may consider if you're writing this maybe days or weeks in advance and you don't want the patient to start getting the treatment, this outpatient prescription until they a certain day. Part might be a good idea to use, but make sure that the day that they need to start this treatment, the medication's actually getting filled. And then the next one, we have an aspirin. And again, a lot of this is already built, but you may notice that day supply and quantity aren't matching. The reason for that is that this has a very specific amount we can dispense in. We can only dispense in multiples of 100. There may be a few of those you'll see, and just if you notice something here that's not matching up, more than likely it's got that. It'll always say this message if it's got a restriction on how many it can be dispensed on, though. If you have any questions about that, feel free to reach out to pharmacy and they should help clarify some. And then we've got another just generic menu here of other things you can order. Again, this is going to be something that's expected to kind of go with the regimen. If you want to order something outside of the regimen, feel free to go into your chemo order set menu to go and order something outside of it. A lot of this isn't going to be already populated because it's not default. It's not got a set dose with the guidelines back here, but some of it may, like this one right here. We've already built it out because maybe that is in a dose pack or something that only comes in a specific size and only taken at a specific time schedule and only has a quantity of whatever. So some of it may be built out, but most of it's going to be fill in the information. All right. And if you change your mind, you can always hit that quit. If you've got the item pulled up, you can hit quit and not order it. All right, once you're done, you can sign the note and the orders if you want to make a change to the orders. So I want to make a change to that one order that I let my finger slip on because it warned me of it. Actually, no, I won't. I'll show you what it'll look like when I sign them all. You can sign them individually, the notes and the orders, or you can go ahead and just review sign changes. And now we see we have a warning here about the maximum dose. So I'll go ahead and change that because let's say I forgot. So I can go in here, change that order to be 3 instead of 32 because my finger slipped. There we go. So that's the benefit of the order sets. They really will, if you accidentally mistype or anything like that, they're able to tell those max doses. Also able to tell any kind of drug interactions, duplicate therapies. They can also pull from non-VA meds or VAs from outside of our VA. So we could get things, if this patient's also going to New Orleans, it'll pull drugs from that as well and compare them all, which is what we're not able to do currently. And then once you clear all of your checks, it will go ahead and sign it. And if you do need to change it, you can go and change it like I did for that bortezomib. But that's it. Thank you.